All right, welcome back to ABA exam review and the continuation of our BCBA practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like, subscribe, and share. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A researcher conducts a tightly controlled study in a laboratory setting to test a new intervention for increasing task completion in individuals with developmental disabilities. The participants show significant improvement, but the researcher is unsure if the results will generalize to real-world settings. What aspect of the study is the researcher concerned about? Okay, pretty wordy question, but overall not a very difficult one. The question wants to know, what is the researcher concerned with? Question says researcher is unsure if results will generalize. So if we have this researcher conducting a study and they're concerned with the generalization of the study, what aspect of the study do we need to examine? A, internal validity. Internal validity is associated with functional control. In this case, does the researcher have control over the behavior in the lab setting? That's not the concern. The concern is generalization. So what the researcher is concerned with is external validity. Will the researcher's results or outcomes generalize to a real-world setting? Does this study have any external validity? C, reliability has to do with being able to do the same thing over and over again, measure the same thing over and over again, not what the researcher is discussing. And then D, social validity has to do with the meaningfulness of change. The researcher is concerned with generalization, not necessarily the meaningfulness of change. So what the researcher is concerned with most is B, external validity. Following a functional behavior assessment, a high school teacher determines a student's refusal to answer questions is maintained by peer attention. If the teacher were to write a behavior plan, which of the following components would be most appropriate given this information? This question is a good example of as you are going through your preparation and you're getting better at attacking the question. So let's read again. Following an FBA, the high school teacher determines student's refusal maintained by peer attention. So immediately we know the student is refusing and the function is peer attention. Now we want to write a behavior plan and we need a component that's appropriate. Well, we know the student is refusing due to peer attention. What would you put in a behavior plan if you were addressing a behavior maintained by attention? A, implement exclusionary timeout anytime the student refuses to answer a question. Well, this is one, a punishment procedure, and two, it's a escape maintained intervention. So we don't want to go to punishment for one, and two, it's not addressing the issue of maintained by peer attention. So A might be appropriate, but is there something better? B, provide no reprimands or feedback to the student if they're not answering questions. In this case, the teacher not giving reprimands or feedback makes no difference because it's maintained by the peer attention. C, ask the student's peers to put the refusal to answer questions behavior on extinction. Now we're using what the assessment told us. Maintained by peer attention, we're going to tell the peers, don't give it attention, aka put it on extinction, and that's going to hopefully reduce the refusal. D, do not allow the student to escape from past demands by not answering questions. Again, it's not escape maintained, right? It's maintained by attention, specifically peer attention. So what we want to do is ask the student's peers to put the refusal to answer questions behavior on extinction. A mom is walking with her daughter. The daughter asks for her water cup, to which the mom replies, not right now. The daughter starts to cry, so the mom gives her the water cup anyway, which causes the crying to stop. Now the mom gives the water cup to the daughter no matter what. What changed the mom's behavior? Very important piece of this question, any behavior question. Make sure you identify whose behavior we're looking at. In this case, it's the mom's, because we have the mom and the daughter. We need to focus on the mom's behavior. What do we know? We know the mom is walking with the daughter. Daughter asks for a cup. Mom says, not right now. Daughter cries. So the antecedent, not right now. Daughter cries. Consequence is mom gives the water cup. Consequence is crying stops. So we have a couple different things to look here. Now we know the mom is giving the water cup to the daughter no matter what. So we're looking at the behavior of giving the water cup. Because you can see, as we highlighted, there are different antecedents and behaviors in this question. The one we're focused on, the behavior, is the water cup giving the daughter, or giving the water to the daughter cup. Giving the water cup to the daughter, excuse me. So the mom gives the water cup is our behavior. The antecedent is starts to cry. When the water cup is given, the consequence is the crying stops. So the crying is removed. Mom continues giving water cup. Mom's behavior has been reinforced negatively. So what changed the mom's behavior? A, positive reinforcement. Well, the consequence is the crying stops. So we've taken away the crying. So it must be negative. B, positive punishment. Well, the mom's behavior continued or increased, so it had to have been reinforced. So the answer must be C, negative reinforcement. Again, mom gives water cup, crying stops. Mom continues to give water cup. Consequence was the removal, which reinforced the behavior. You can see the behavior questions can get a little tricky when there's more than one person and more than one behavior. Focus on one, who you're looking at, and two, what behavior are you focused on? A collegiate track coach designs a program to help an athlete increase their sprinting speed. After implementing the intervention, the athlete improves their speed by 15% within a month, meeting the athlete's goal. What dimension of applied behavior analysis does this reflect? So we have a dimension question. We want to be very specific and very precise. What information are we given? Well, we have a track coach, a program to increase sprinting speed. The intervention is implemented. Speed goes up by 15% in a month. Athlete achieves goal. To me, this looks very effective. So let's look at A, conceptually systematic. Nowhere in the question are we talking about ABA ideas or principles, so we're not sure if it's conceptually systematic or not. We do know it's effective. We've achieved the athlete's goal. Speed went up, goal achieved. Did it generalize? We don't know, right? There's no indication it's been generalized. And is it technological? Is there anybody who can demonstrate the coach's program? Not according to the information given. So all we know so far is that this plan was effective. Notice how we started to predict that answer before we got to the answer choices. When you're practicing, work on doing that. That's going to help you engage more with the question. A life skills instructor is teaching adults with disabilities how to use different types of public transportation ticket machines. Knowing that machines vary by city and system, the instructor first goes around their city to get a better understanding of the type of machines the adults will be using each day. What generalization strategy is the life skills instructor using? So one idea or hint when we're talking generalization strategies, because there are several, is to first think about, are we planning for generalization or are we actually implementing strategies? If we're planning for generalization, because this life skills instructor is planning for it, when I mean planning, I mean they're creating what they're going to implement later, because the skills instructor, knowing the machines are different, is going around the city to understand what he needs to teach each day. And so if we're planning for generalization by going around the environment, the natural environment in which our learners will be existing in, what are we doing? Well, we're conducting a general case analysis. The general case analysis is going to allow us to train multiple exemplars, program common stimuli, and train loosely. Without the case analysis, how do we know what exemplars to train? Or how do we know what stimuli to vary? So we've got to start with this general case analysis, like this instructor, so we know what to modify, what to include, and what to teach when programming for generalization. A professor who teaches his classes remotely is tired of his students not paying attention during virtual meetings. He wants to develop an intervention to change this behavior and starts to write a behavior goal that he hopes is both observable and measurable. Which of the following definitions would meet this goal? Okay, so we have a definition question. Should be pretty straightforward. We want something that is observable so we can see it, and we want something that is measurable so we can measure it. Now, with goals, clear, concise, complete. So let's look at A. What are we trying to define? He wants a behavior that is both observable and measurable because he's tired of his students not paying attention. So let's look at A. The student will focus at a higher rate over the next 3 weeks compared to the previous 3 weeks. Measurability wise, it's not bad, right? We're taking rates, we're comparing it, but we didn't really define focus. What does that mean? What does focus actually mean? Can we do better? B, the student will actively engage in each virtual meeting for 2 weeks straight. Okay, so we do have a time frame. What does actively engage mean? Can we do better? C, the student will turn their camera on, okay, observable, answer at least one question, observable, during each virtual meeting for 2 weeks straight, measurable. C is pretty good. Observe, measure. D, the student will remain attentive with the camera on, observable, during each meeting over the next 2 weeks, measurable. D is not bad, but what does it mean to remain attentive? The most specific, clear definition that includes measurability is going to be C. Student turn camera on, observable, answer a question, observable, for 2 weeks straight, measurable. C is the best answer. Jason, an amateur tennis player, is attempting to increase the power of his serve. He looks up how fast a professional tennis player serves the ball and finds that serves often go over 100 miles per hour. Jason instead sets his goal at a good amateur level, which is 70 miles per hour. He takes his average miles per hour and compares it to 70 miles per hour benchmark. What self-management strategy is Jason using when comparing to the benchmark? So the question is very specific. It wants a self-management strategy used when comparing to the benchmark. Because what is Jason doing? He's trying to increase his serve. So he finds out what's the normal to compare against, 100 miles an hour. He says, I can't achieve that, so I'm going to set my benchmark at 70 miles per hour. So doing that and comparing to the benchmark, is that A, self-talk? Well, no, there's no indication of self-talk in this question. Is it B, self-monitoring? Jason is likely self-monitoring, right? He's taking data on himself, but the question is about asking about the comparison to the benchmark. And when we're talking comparisons, we're really talking C, self-evaluations. Jason is evaluating himself against a prior benchmark. Mass practice is overcorrection. Jason is not engaging in overcorrection. Either way, that's not what the question is asking about. It's asking about that comparison to the benchmark, which has to do with C, self-evaluation. A behavior analyst is working with a 6-year-old child who has significant language delays in addition to behavioral challenges. While the treatment plan that was developed addresses the behavioral issues effectively, after a long period of time, the child's language skills are not improving at all. What should the behavior analyst do to best support the child's overall development? Okay, so you might find yourself in a situation like this. You've got a client, big delays in language and behavior challenges. Your treatment plan is great. You are addressing your behavior issues, but the language skills are not improving. And so in this case, we've got to take action because it says after a long period of time. And it's safe to assume that this particular behavior analyst just might not be either targeting these or well-versed in these or competent in these, which is fine. We are behavior experts, not necessarily language experts. So what should the analyst do in this case? A, continue to focus on behavior as speech development is not within the analyst's scope. Yes, maybe, but that's not enough because the analyst has identified this as a problem, and this is going to affect other aspects of behavior. So we can't just ignore the issue, even if it's not our expertise. B, begin writing speech interventions based on what the analyst knows about language development. Well, it's been a long time already. They're not improving at all. We need to try something else. Something needs to be done. C, give the client a few more months to see if language starts to develop naturally. We should not wait and see. Wait and see is rarely a good approach, especially if it's already been a long time. And then D, consult with the stakeholders over the possible benefits of a speech therapist. Yes, as the analyst, and you've identified this problem, it's your job to help guide or at least discuss potential opportunities for the parents to address issues. If we fix this issue, it's going to help you as well, We always are looking out for the best interest of our client. The best thing we can do here after a long period of time, consult with the stakeholders over the possible benefits of a speech therapist. You passed your board certification exam and are now preparing to start supervising 2 students in an ABA master's program working towards their certification. In order to deliver supervision effectively, what should you make sure and do? All right, so we have an effective supervision question, and you are going to supervise 2 students. What do we have to do? What's important in supervision? A, develop a supervision contract that outlines roles and expectations. 100%. Before anything, we need to get in writing. What do you expect? What are your roles? What are their roles? What are we hoping for out of this relationship? B, explain to the supervisees that you're not allowed to be their friend. You can supervise your friends, you just can't have a romantic relationship with your friends as long as there's no conflict of interest. So B is not necessarily true. C, require the supervisees to supervise the technicians on your cases so you don't have to do it. Absolutely not. You should not give the supervisees your work. D, give the supervisors full independence on their cases so they don't develop a dependency on you. Should be the opposite. You should be there for them, guiding them, directing them when they need help. So the best answer here is A, develop a supervision contract that outlines roles and expectations. An ABA clinic developed a training manual for the new behavior technicians. After signs of success with the manual, the clinic decides to sell the manual to other clinicians who are then able to effectively replicate and use the manual without additional training. What dimension is shown here? All right, another dimension question. Let's be very precise. We've got a training manual that is successful. The manual is sold, and then those clinicians can now replicate and use it without additional training. So that's fantastic. That means the manual is very technological. So pretty straightforward dimensional question. Do we know it's conceptually systematic? We don't know. Nothing in the question discusses conceptually systematic approaches. Is it pragmatic? Well, pragmatism is not a dimension, so be careful. And then analytic. Are we demonstrating functional relationships? Not according to the information given. So according to the information given, the dimension here is technological. Thanks for watching. Be sure to like, subscribe, and share. Check out behavioranalyststudy.com. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.